Welcome back, everybody, to the OPT Network. This segment is brought to you by attorneys Hunter and Beck. When you hire Hunter and Beck, you get Hunter and Beck. This morning, we're talking about a conversation that every single person really across the country is no stranger to, and that is the opioid crisis. Statistics say that more than 100 people have lost their lives because of opioid overdose. Here to talk about what we hope to do and how we hope to begin to conquer the problem in Central Louisiana is Dr. David Holcombe. He's the director of the Department of Public Health here in Alexandria. He's been a practicing internist for the last 2 decades, and now his job is to really bring us into hopefully some solutions. Dr. Holcombe, good morning and welcome.
Thank you for inviting me.
This is such a lofty conversation. It's so big. So many people, as we sit here today, have either been at the ER with a loved one because of an overdose or have died because of an overdose. When did this all start?
Well, this actually started decades ago.
Decades ago.
So even in the 60s and 70s, there was massive marketing for opioid medications legally. And the drug companies were, how can I put it, disingenuous about how addictive these things would be. And it was heavily marketed, and physicians prescribed it heavily. And there was a big demand, and so the use just rose, it must 5, 6, 10 times higher use than it was many years ago. And so what happened was that many of these people became addicted, because you can actually become addicted to opioids after 1 week of use.
1 week?
1 week. There's a certain percentage of people who will become addicted. So we had these hundreds of thousands of people across the United States who were essentially addicted to opioids. And then we started having this. We started having deaths, overdose deaths, just an epidemic. And so now the physicians are it said, look, we're part of the problem. How can we be part of the solution?
They admitted that they were part of the problem.
Some more easily than others.
So they acquiesced, really?
Yes. And so they, but the ACP and other, AMA said, look, this is our problem too. So states passed laws, including Louisiana, for prescription monitoring programs, so that now someone comes in your office, you can put their name in, and it'll show all of the controlled substances that they've been prescribed by every prescriber. So all of a sudden, doctor shopping became a lot more difficult. And in Louisiana, we actually have reciprocity with Texas, with Arkansas, with Mississippi, all these surrounding states, and then other states across the United States. So you can go in there, and now you can only prescribe a week at a time. So those are very serious restrictions.
Even a week at a time, if you can become addicted in a week,
yes.
How do we balance that?
Well, first of all,
we know everybody's not going to be addicted,
right,
or going to become addicted,
but a certain percentage will.
Right.
And so the better rule is 3 days, the 3-day rule. And even that, if you go to the dentist or the orthopedist or whoever, you're likely to get at least a week's supply.
Right.
And, probably shouldn't take that much. So anyway, so we have these hundreds of thousands of people in the United States who are addicted. The doctors don't want to lose their licenses, so they are now prescribing less and less. There's less and less available on the street for the black market, and people, they call them legacy addicts, turn to heroin because it's cheaper.
Right.
It's cheaper to buy that than it is to find OxyContin on the black market. And then to increase, the use of it, the people who sell that sort of thing are now adulterating it with fentanyl, which is 100 times more potent than heroin.
Did you ever think in your lifetime that in Central Louisiana, more specifically, anywhere in Central Louisiana, but in Alexandria, Louisiana, that we would begin to see people dying from fentanyl use?
Unfortunately, this was all pretty predictable, because once you have the people that are addicted and you have the demand, addiction is a terrible health problem. And people that get into that are it's murder to get out of it.
Do you think that we have attacked this health problem the wrong way or not attacked it at all?
Well, we've attacked it better this time than when we went through the crack epidemic.
Okay.
Because I don't know if you remember all that.
Yes, I remember.
You're old enough to remember
Yes, I
all that.
remember the crack epidemic.
The crack epidemic was mostly limited to inner city. And so it was mostly considered a inner city black problem.
Right.
And the solution was not medical, it was legal. You put everybody in jail.
Right.
And so there was massive incarceration as a response to the crack epidemic.
Right.
This is a little different because heroin has infiltrated into the whole society, so it affects.
Isn't that something? How for one ethnic group we handled it differently, but now that it has overflowed into, other ethnic groups or more ethnic groups, now it's not so much throw them away.
Yes. Well,
Let's get them
now
help.
it's not incarcerate them. This is a medical problem.
Wow.
So let's provide medications that can be used and services, but even that there's nothing like the demand. The demand far exceeds the available resources because of the sheer numbers of people involved.
Wow.
It's a terrible thing. And there's all sorts of problems.
So when the Department of Health is presented with this problem, and it's not just one ethnic group, but it's the population at large, how do you begin to wrap your head around it so that you can find a solution so that people stop dying?
Well, this is a national problem.
Absolutely.
It's not
Absolutely.
just a local problem. And so there's all sorts of things that are going on that are trying to address this. And one of the reasons I'm here today is to talk about the syringe exchange program or safe syringe program. And this is just one tool to address the problem. And people say, oh, this might enable people and you're going to give syringes.
And you're telling people to go ahead and use.
Yeah, I mean, that's the perception.
Right.
But in fact, these programs have been around for 20 years. There's 31,000 of them across the United States, and they've been absolutely proven to be helpful. Because what they do is, if people are obliged, not obliged, but if they take advantage of this service, more of them will get into recovery programs. Your number of overdoses drops. Because people have clean needles, they're not transmitting HIV and hepatitis C. You reduce the number of needle sticks in law enforcement and at homes and various places, parks. We had an incident.
Right.
And actually crime goes down. So there are 5 really good reasons to implement these programs and no real downside.
No real downside.
No real downside.
So when you looked across the country and you saw the numbers and the statistics, when do we decide to present this to our city and our communities in Louisiana?
Well, first it had to go through the state legislature because there are many states where having paraphernalia is still illegal under any circumstances. So there are states they can't do this. But in Louisiana, they kind of got the message, and so the legislature essentially took away preemption. And they said, if a city wants to change their ordinances, they can, in the context of these safe syringe programs.
So now they're leaving it up to each individual city.
Yes, and New Orleans and Baton Rouge and Shreveport have all enacted legislation to start these plans.
Okay, let's take a break here, but when we come back, we're going to talk about these plans, something called harm reduction. Now, we've talked about it on our show before, but we're going to take a little bit deeper dive to see what that might look like in our cities. Stay on point. We're back with more right after this. Welcome back, everybody, to the OPT Network. This morning, we're talking about some really challenging, what has become health issues. We're talking about opioid overdoses, hepatitis C, so many of these illnesses, really, I guess, Dr. Holcombe, you would call them illnesses that can...
Those are truly transmittable infectious diseases.
Infectious diseases. Dr. David Holcombe is our guest this morning, and we're talking about something called harm reduction. First of all, let's talk about all of these diseases that can come from using dirty needles.
Well, the big two, I mean, there are other ones like methicillin-resistant staph at sites of infection and so forth. But the two big ones are HIV and hepatitis C. And hepatitis C almost went away. And then with all the opioids and injectable drugs, then it started to rise up. And that's because of exchanging needles and all that kind of stuff. And HIV is exactly the same. They've made tremendous progress in treatment.
Right, and people are living now.
Absolutely. You can have a normal life, but only if you're in program and diagnosed. And for either of those diseases, it's for syphilis too. It's not transmitted this way, but 25% of the people who are infected don't know it. So HIV, 25% of the people wandering out there.
Because there are no real symptoms.
Yes, until you get way advanced.
Right.
And so these harm reduction, safe syringe plans also allow people to be tested for those diseases and then get into the proper treatment.
And so I'm seeing a large contingent of people that I know personally that are addicted to opioids that have been diagnosed with hepatitis C. Let's talk about the outcome of being diagnosed or having hepatitis C and not getting treatment.
Well, ultimately what happens is you get cirrhosis or you get liver cancer. And those are both the fatal endpoints of hepatitis C. And the wonderful thing now is it's actually treatable.
Just like HIV and AIDS.
Well, it's better than HIV and AIDS because you can get actually cured. So you can be cured. You don't just, suppress the germ or the virus. You can actually be cured. And the state of Louisiana has been very progressive. Dr. Gee has worked with the pharmaceutical companies, and now there's going to be a method by which people can get affordable treatment for hepatitis C. This didn't exist before. And so now, Tulane CD4 Clinic also has a hepatitis C, and I think Rapides Primary is also working on being able to have a provider to treat it.
Wow.
That's wonderful. And so if people come through these kinds of programs, they're going to get tested, whereas they may not have been tested before.
And so is there a point where it will turn into cirrhosis? I mean, how long can the virus live in the body before, if we know? Because so many young people that are addicts right now are not getting the treatment for Hep C.
It's decades.
It's decades.
It's decades. So you're talking about 20, 30, 40 years after infection. So this is a long-term process. So stopping it at any point is advantageous.
Wow. And so let's talk about the harm reduction program that we hope to see in our community. And I want you to explain to our listeners and viewers why this is not something that they should oppose but yet embrace.
Well, we talked a little bit about all the advantages to these things. They're not new. They've been around 20 years in the United States. They've been amply studied. They don't increase usage, okay? In fact, more people will go into recovery programs. So those people have a chance, they may not complete the program, but they have a chance of actually getting into some other, getting off entirely.
Because like parents and people who love someone that's addicted, they don't want necessarily to be able to see them go and get clean syringes. They want them clean. They want them into treatment programs, but we know that can only happen when the person decides that it can happen.
Right, and that's very difficult, and it's a minority of people that actually do that. But even as a concerned parent, I wouldn't want my loved one to get HIV.
Right.
Or hepatitis C, or overdose unintentionally, which are all consequences of, use.
Sure. And so the harm reduction program, give us some insight on, the community that you're coming together, that will be coming together to create a harm reduction space, if you will.
Well, first, the city has to pass an appropriate ordinance that actually permits people to have paraphernalia that comes from such a site, okay? Because otherwise it's illegal. It's still illegal to have, IV drugs and stuff on your possession, or heroin or fentanyl. That's still illegal. But you won't be arrested for paraphernalia. Okay, and so that allows these programs to take place, because if they don't, then everybody that walked out of one could be arrested and thrown in jail. Police enforcement law enforcement actually supports these programs because they do see the advantages. And reducing the crime that comes along with these is to their advantage. Reducing needles all over the parks and public places is to the city's advantage and law enforcement's advantage. And knowing people that are coming to a site means that they're not out there in the general community committing crimes to even get their drug paraphernalia.
And so as you are getting into this conversation in Rapides Parish especially, what is the feeling for harm reduction sites?
It's a new idea for here, and it's like all new ideas, there's some resistance to change. There's always resistance to change, even though the change is necessary and moving in the right direction.
Because what we're doing, obviously, is not working.
Right, and that's the whole problem, is that having people, what is happening is we're having an increase in the number of HIV cases and the number of hepatitis C, and it's all related to...
And what about overdose?
And then overdoses, deaths, and ER visits and hospitalizations. All of that has continued to rise steadily, and anything we can do to help that is going to be good.
And would you say, Dr. Holcombe, that we really, as a community and as a parish, we really haven't done much except for really arrest people? I mean, I can't see, and maybe you can tell our listeners and viewers, I can't really notice what we've done to stop the problem. And I don't think anybody really knows what to do, but you got to try something.
Well, Dr. DeCare is over the Office of Behavioral Health, and they do have programs, and we do have treatment facilities, and we do have all those sorts of things. But, this doesn't replace those.
Right.
It's synergistic with those. And if you can get more people into those programs, then you're going to have a certain percentage that are actually going to stop. And that's what your goal is.
Absolutely. And then when we talk about even treatment centers, we're seeing treatment centers close.
Yes.
In this area. But when you talk about treatment, again, a lot of families are wanting loved ones to go into treatment. They're going into treatment. They don't really necessarily want to go into treatment, and then they're coming back to the streets, far worse than, when they started, really.
Well, I'm not sure they're worse, but they're maybe not improved. And my heart goes out to families dealing with this. This is a nightmare for folks.
Yes, it is.
And it is like a black hole that sucks everything down with it. And that is horrifying. So anything we can do to arrest that, to offer other alternatives, to get people into programs, to keep them from having HIV and hepatitis C, anything like that is helpful.
And in that harm reduction space, is there going to be an opportunity for the experts to talk to them about overdosing and about these drugs and about, of course, everybody understands the dangers, but you feel like you're invincible.
Right.
You feel like it happens to others, but it would never happen to you. Is there an opportunity for those sorts of conversations to happen?
Well, part of this has an educational component. It also has a testing component. Test people for HIV and hepatitis C. So there's all sorts of, and of course, class also has STD treatments and other things, syphilis treatments.
And remind people what class is. A lot of people know, but a lot of people don't.
Well, it technically it's the Central Louisiana AIDS Support Services, but they do more than that.
Right.
And so they're going by the acronym CLASS, because they don't want people to not come there because they think
it's only
about HIV, it's only about AIDS, because that's not true. And this is why they're interested in this, because it also expands their services.
Sure. Are you hopeful, Dr. Holcombe?
I'm very hopeful, and I will work on it until it becomes a reality.
Absolutely. Let's make sure that we continue the conversation, that we continue to educate people so that we can all have a better understanding. Because here's what we know for sure. Nobody is unaffected by these issues. Nobody. Everybody either has a loved one or knows somebody who is battling this. And so it's all of our battle.
Yes, and it's a national tragedy, and it's a local tragedy.
Absolutely. Dr. Holcombe, thank you for taking the time, and let's make sure that we revisit it and that we follow the progression of harm reduction.
I hope the next news will be that the City Council has voted an ordinance that opens the door to starting this program.
Well, I'm going to be in agreement with you on that. Dr. David Holcombe has been our guest this morning. Stay on point, everybody. We're back after this.